Okay, so welcome everybody to another one of these brief Teams talks that we do on Wednesdays following convocation. And today I just wanted to um, uh, show everybody what they can access through AccessPharmacy, which is a resource that I'm not sure everyone's familiar with. We've had it for a little while now, but not as long as Access Medicine. It's made by the same company. It's made by McGraw-Hill, so it should be familiar. But like I always do, I try to show where you can find this resource. And so if you go to the main LUCOM library page, which if you haven't been to it in a while, it looks a little bit different. We've updated it some. But you'll find under the LUCOM library resources, under available databases, you'll see Access Biomedical Science, Access Medicine, which you probably are familiar with, but also Access Pharmacy. And also, if you click on the course guides and textbooks, which opens up the LibGuide, you'll find AccessPharmacy here under featured resources. It's also on the A to Z database list. So if you look here, AccessPharmacy is listed among those. But clicking on that will take you to what probably looks kind of familiar. It's laid out the same way that Access Medicine is. And I just want to point out a couple of features that could be useful for student doctors as well as faculty. And some of these books I know that you guys use, I'm not sure if they're required textbooks. Goodman and Gilman's Pharmacological Basis of Therapeutics, I know that I think you guys use that textbook. I'm not sure if it's required or not. But just like in Access Medicine, if you click on books for the dropdown, it'll have library and updates. But if I click on library, it'll show me all of the textbooks that we have access to. It also gives a little navigation pane under here if I want to look for different kinds of health policy, infectious disease, medicinal chemistry, whatever section you're looking for. A lot of lang text in here that you're probably familiar with, basic clinical pharmacology. I know that you guys use, but you can access any of these books here. And so if I were to go back and click on one of these, Goodman and Gilman, it's going to take me to the textbook. It's broken down by section. I can open up each section and it's got the chapters, and these should correlate to the print version of the textbook. It doesn't give you a PDF of the chapter, so it's not like going to have page number, but you're still able to find the same chapters and sections. And just like in Access Medicine, you can download PDFs of this chapter. You can share it. You can find figures and tables that are accessible here. And one of the things I want to point out for faculty, like I always say, it's not totally imperative that you make attribution for every figure in one of your lecture slides, but it's a good habit to make attribution for what you're putting into your PowerPoints. And there's a link here, just like in Access Medicine, where if I find a table or a figure that I like, I can download the PowerPoint slide, and it'll automatically create a slide that makes attribution to the resource, so you're showing where you got it from, who created it. And PowerPoint, I guess, has taken a while, but it gives you a full attribution here for where the figure was found. So it's just a good habit to use. I also want to point out there are practice change updates, just like maybe we're familiar with UpToDate or maybe Dynamed, but they have it under What's New. And if I click on What's New, it's got evidence-based pharmacy practice updates. So any kind of new developments in the field are going to be found here. There's a blog available. This quick reference I really wanted to point out is pretty cool. It's got a couple different features. It's got herbs and supplements, quick answers, and FDA MedWatch. But the herbs and supplements is really neat to me because I could see how a clinician could use this. You can actually look up by the supplement name. And if I click on one, it gives me alternate names, background, disease interaction, dosage, how much people should be taking, effectiveness, all kinds of information. A lot of times that I didn't realize was available in some resources, but you can find all kinds of safety ratings, toxicology of these different supplements that patients might be taking. So I could see how this could be used in a clinical setting. The quick answers is broken down by systems, and it's alphabetical, so I can look through acne vulgaris, acute kidney injury, different syndromes that people might be suffering with. You can go through alphabetical list here, and it'll give you pharmacological information associated with that that particular condition. The drugs database, if you've used UpToDate, then you're probably familiar with LexiComp. If you've used Dynamed, you're probably familiar with IBM Micromedics. This is just another drug database that's available. It's very similar to LexiComp or IBM Micromedics if you've used those before. It's got an A to Z list of all drugs. It's got generic and trade names, patient handouts, drug classes. Let's see if I can pull one up. It even gives you an image of what the tablet's supposed to look like, all the safety issues associated with it. I think it has contraindication information available. Yeah, contraindication, indication and usage, adverse reactions, interactions. So all that information, if you've used LexiComp before or IBM Micromedics, this is just another resource which again could be used in the academic setting or in a clinical setting. There is a multimedia available for various different pharmacology issues. And this is more of a study resource, I think. There's cases available. We used to have a resource called Case Files from McGraw-Hill. We don't have it anymore, but these are just cases that are specifically tailored to pharmacology that are available for students. And study tools I really wanted to point out is if you've used your MyAccess profile and Access Medicine, then you'll be somewhat familiar with some of this, the flashcards that are available. There's review questions. What's really cool is these review questions actually pull from textbooks within the collection. So DePiro, Basic Clinical Biostatistics, all these different textbooks, you can actually pull questions and flashcards, all kinds of self-study resources. I think you have to sign in. You might not have to. Yes, so you'll have to sign in with your MyAccess profile. If you've already created one for Access Medicine, I believe it should work for AccessPharmacy, and that'll give you access. You'll see there's 56 questions just from this one resource, and there's a whole bunch of resources review questions are available from. So I know you guys use this one, Integrative Medical Biochemistry. So there's going to be some textbooks in here that are familiar to you. And again, the flashcards are available just like they are in Access Medicine. And there's some kind of shortcuts to pharmacotherapy, flashcards, top 100 non-prescription drug cards, things like that. And there's even patient education information, so I can see again how this can be used in a clinical setting. And you can also search at any time using this search bar, which is probably familiar from Access Medicine if you've used that before. So that's basically what I wanted to show today. I know it's really just kind of a tour of a resource, but we haven't had this one as long as Access Medicine, so I just was assuming people might not be familiar or be aware that we have access to it. We didn't actually purchase this. We purchased Access Medicine, but the main campus library, the Jerry Falwell Library, actually purchased access to both AccessPharmacy and Access Biomedical Sciences, so we get access to all three of those resources, which is really great. It's a great benefit of being part of Liberty University that we get to share resources with the Jerry Falwell Library. So that was it for today. I hope everybody has a good rest of your day, and everybody just have a good night.